One of the biggest deciding factors for me was that Cornell provides the opportunity to work with animals from the first day that you get in here. You're always from day one starting working on animals and applying the knowledge that you are getting from the classroom to the hands-on experience with the animal. And to me, that was one of the most deciding factors of choosing Cornell. I love that our curriculum is case-based, problem-based learning. To me, it creates long-term memory. So we've all sat through the classes where we have to cram and memorize a number of facts, but case-based learning isn't like that. It takes the knowledge that you have and makes you apply it to certain cases. And to me, this kind of builds a framework. I find the things that I remember the most and I'm able to apply to my patients are the things that I learned through case-based learning. From your first year, after you finish your bigger course called Block 1, you can apply to a number of jobs in the hospital. And some of these jobs range from being the small animal emergency CC technician to a small animal surgery technician to working on the large animal side as a large animal medicine technician or working with the large animal surgeons as well. And there's a bunch of different jobs that fall in between. And this opportunity gives you the ability to work yourself into the hospital earlier than when you would be starting clinics and gives you exposure to a bunch of different cases. And the biggest thing that this helped me with is it always seemed that something that I was learning in the classroom would come up at my job. So if we'd be learning about horses with colic, we would have a horse that would come in for colic surgery, and I'm able to apply the principles that I was learning in the classroom to the case that was coming in the hospital that I was helping out with as a technician. To me, this really helped solidify my understanding of the diseases that I was seeing and learning about in class. The faculty are amazing to me, and it's crazy because when I was coming here, I did put them up on a pedestal. But from the first day I came to rounds at 7:30 in the morning, the clinicians, they were so engaging to us and wanting us to learn. It was kind of like that we were all one of us and all working in the same profession, and there was no barriers, and I really enjoyed that. Coming in, I was very tunnel visioned. I was going to be an ambulatory dairy practitioner. And one of the beauty of the things of our curriculum is you're taught the basics of the 4 major species, and when you come out, you're going to be a well-rounded veterinarian who can practice on any one of these species, which is really phenomenal and amazing to me. And as I've opened up my mind and experienced a bunch of different areas in the hospital, I've realized that I really fell in love with surgery and surprisingly have changed my path from being very tunnel vision dairy practitioner into wanting to be a small animal surgeon.